Welcome to the brand new medical series on the Narcolepsy Navigators podcast, where real stories meet expert insight. In this special series, we're diving deeper into the medical side of narcolepsy, not just the condition itself, but the often overlooked comorbidities that many of us face. From sleep apnea and heart disease to high blood pressure and even dementia, we'll be unpacking how these conditions interact with narcolepsy and what it means for our daily lives. We'll be sitting down with leading experts to ask the questions that matter. How can we prepare for these challenges before they catch us off guard? What tools and treatments can help us manage them effectively? And most importantly, what can we do to slow down the progression and protect our long-term health? Whether you're newly diagnosed, a long-term warrior, or supporting someone you love, this series is here to empower you with knowledge, clarity, and practical advice for the journey ahead. So grab a cup of tea, settle in, and let's explore the full picture of narcolepsy together. Hi everyone, welcome to Narcolepsy Navigators. I'm Kelly, your host. I have narcolepsy type 1.
And I'm Sakara, your co-host, and I have narcolepsy type 1 as well.
And today we're here with Dr. Chris, and this is a part of our medical series.
Here's a little to know about Dr. Chris. Dr. Christopher J. Allen, MD, is a board-certified pediatric neurologist and sleep medicine specialist. As founder of Quality Sleep and Neurology PC in Saginaw, Michigan.
Saginaw, Michigan. Don't feel bad. Everybody does that. So it's Saginaw, Michigan.
He treats both children and adults with sleep disorders and neurological conditions. A strong advocate for accessible sleep science and non-CPAP treatments, Dr. Allen shares his expertise through podcasts, social media, and collaborations with organizations like Women Heart to highlight the vital link between sleep and heart health.
Well, first of all, ladies, thank you for letting me be on here. And just a little bit more, about me. And so again, I'm a sleep medicine doctor. I'm also a pediatric neurologist. I love neurology, but sleep is my passion. I'm involved with a lot of things, and people in the social media world know me as Sleep Dr. Chris. So if you put in Sleep Dr. Chris, you'll see me there. I love taking care of my patients. Again, as you guys said, I am like the only physician of my own practice. I've been doing this for a year and a half now, having my own practice. It's been amazing. So I'm just glad to be here. Love to talk about sleep. I can do it for hours. We won't be doing it for hours, but I could.
That's good. Thank you and welcome. We're glad to have you here.
So our first topic is diagnosis and expertise. First question, what led you to specialize in both pediatric neurology and sleep medicine?
I love that question. I was a pediatric neurologist first. And one thing about neurology, I love looking at someone's body and seeing the part of the brain it comes from. And it's just amazing for that. Being a neurologist, it's really hard because sometimes I deal with disorders where people will say, well, there's nothing you can do about it. But those patients still need help. And so from seizures, from developmental delay, or even genetic disorders, I take care of them and able to help them out. And that's something that I really appreciate and love doing. Now, it's funny with sleep medicine, I tell this story all the time, and this is taking you into Dr. Allen's office. I usually tell them this is like, not only am I your doctor, I have obstructive sleep apnea, and I've been treated for the last 21 years. And I learned about sleep apnea while I was in med school and as in a lecture. And it's funny, my girlfriend at the time when they were talking, she was laughing at me. My friends were laughing at me. It's like, that's you, right? I'm like, no, it's not.
Recognized it before you.
Yeah. And you think at that moment, I would have been like, wow, I really need to get a sleep study. Nope. What got me to say, you know what, maybe I'll get a sleep study. It's funny. The same day I walked out of that class and I looked on this board and it's like, are you a male that snores and is tired? You can be part of this research for money. And I'm like, ooh, this is something I can do for money. And so I had the sleep study. I remember they put all the stuff on me for the research. And then I remember I fell asleep, woke up, and they're all still hovering over me the next morning. They're like, yeah, you got it. You got sleep apnea. And so being treated for obstructive sleep apnea, I just love the fact of what it did for me. It took me 3 months to figure that out because I went on a trip. I didn't take my CPAP with me and I felt horrible. I used CPAP therapy. And I'm like, you know what? Maybe there's something to this CPAP therapy. And the funny thing about it is that I didn't even know what sleep doctors were because I was using CPAP through residency and even training. And then I found out you could be a sleep doctor. I'm like, what? I thought like pulmonologists just do it. But you can be any part of any practice and just do a sleep medicine fellowship. And so even though I fell in love with neurology, during my neurology training, I did a rotation where I got sleep medicine. And doing that, I had that same feeling with neurology. I was like, I could do this for the rest of my life. And so that's why I went into sleep medicine. I love it. I can empathize with my patient, knowing how it feels to be tired, knowing how it feels not to have quality sleep. And so that's why I did that.
That's so interesting. I have a few questions. Why did you think that only pulmonologists did it?
The hard thing in the United States, they're getting better about talking about sleep now.
Mm-hmm.
Back then, throughout my whole 4 years of medical school, there was only one lecture about sleep. And so then you hear about sleep or sleep apnea and maybe narcolepsy. And then after that, you didn't know. And they wouldn't even say that, oh, you know, sleep doctors, you can do a sleep medicine fellowship. And even the field of sleep medicine is one of the younger fields. And so that's one of the big reasons why people won't know about it. But initially, most of pulmonologists or lung doctors, those are the ones that were naturally doing it initially. But it goes across all specialties, which is amazing because you have different minds and aspects that can go to that. And then unfortunately, a lot of people don't know about sleep medicine. And that's why I'm a sleep doctor, to put myself out there to make sleep cool. That's why I do social media as well, where people can hear about that, because the hardest part about my job, I got to talk to people about what happens when they're unconscious. So with like sleep apnea or sleep disorder, I have to talk to them to figure out what's happening, but they're asleep. Or like when you have central disorders of hypersomnia, such as narcolepsy, you have to be specialized, because a lot of my patients, even colleagues and friends of mine that have narcolepsy, it's been misdiagnosed or saying that it's depression. And, you know, it's good to know about that.
Yeah, 100%. I like what you said there about having a partner. It's so true. I would not probably have realized I had sleep apnea because I already had narcolepsy diagnosed so early. But then I just thought my narcolepsy was getting worse.
Mm-hmm.
And then I was dating someone at the time and he just kept making excuses why he couldn't stay over. And I just thought, you know, I'm fed up of this nonsense. And he goes, oh my God, you make this noise in bed. I was like, if you don't want to stay over, you don't have to make up stories. And then one night I had a shock and it threw me out of the bed and I broke the bedside table. And then I realized that jolting thing that he was saying that was happening to me, I was swearing that nothing had happened. That's what it was. When I called them and I was told them this is to come and have another sleep study, that was the time I had my second sleep study done. And then I got diagnosed with restless leg and sleep apnea. And I said to the neurologist, okay, when I was 18, you never said it was possible to get anything else. And he said to me, yes, if you have one sleeping disorder, sometimes you can get another. And I was like, oh, nice to know years later.
I spent a lot of years training and being a sleep doctor. You wish that you can get one diagnosis and that's it.
Mm-hmm.
But unfortunately, it doesn't keep you safe from anything else. And I always tell patients, especially if they have narcolepsy, it doesn't keep you safe from other disorders. And it's like, oh, they're tired. Oh, you know, let me titrate their narcolepsy medication. But no, I still ask those simple questions, because I always joke, you know, I'm not a sleep apnea doctor. I'm a sleep doctor. So I have to look at every aspect of your sleep. And even with restless leg syndrome or periodic limiting with the sleep, is that fancy way of saying that you're moving your legs in your sleep. But then the restless leg syndrome is that urge that you got to move your legs,
Yeah.
especially in the evening. I equate it to when you have to go to the bathroom, you have an urge like, oh, I got to go. Sometimes it can be like that with your legs, like I have to move my legs. And then just like when you go to the bathroom after you really have to go, you get that relief like, oh, okay, that feels so good. That's what can happen with restless leg syndrome too. And sometimes it's just hard to talk about or to explain.
Yeah, have the language.
Well, just not even the language, also from the patient saying like, I can't explain it, but my legs feel a certain way and it's worse in the evening. That makes me ask those questions like, oh, well, do you have like restless leg syndrome? Well, I lead up to it. I don't say, do you have it? Because everyone's like, yeah, my legs are restless, but there's specific questions that you ask. So for example, like that urge to move your legs at night, or once you move it, you get that relief. You like little things, like that. Or even when you're sleeping, if you do kick your legs or jolt your legs, like you were saying.
And restless leg, can it also affect other parts of the body? Because I found that it felt like the insect or something was inside of my skin and it was crawling in my arms.
Oh, yeah. The creepy, crawly sensation. And I know they call it restless leg syndrome, but it can happen in other extremities too. So it can happen in your arms. And it's funny because it happens in children a lot. And sometimes it's hard to explain for kids. And so call it like, I got ants in my hands, or it feels like my legs feel hot. Or they'll draw a picture and they'll draw like fire on their legs because they're trying to explain how they feel. And I think that's the benefit of being a sleep doctor because, some of my colleagues, they're aware of it, but like I go in depth to make sure.
That's great.
How do you approach diagnosing sleep disorders differently in children versus adults?
What I do for both patients, I give a comprehensive exam and we talk about everything about sleep. And as I was saying earlier, sometimes it's hard for children to express how they feel. And so I have to have a good nuanced way. And what's easier because their parents usually will see them sleep and so they can answer a question. I look for all sleep disorders, but for example, obstructive sleep apnea, it's different in kids than it is in adults. So for obstructive sleep apnea, I might ask, well, do they feel like they're hyperactive? Because symptoms of ADHD can mimic obstructive sleep apnea in kids. And so I ask questions like that, or if they are snoring, because sometimes they might not be snoring and just sleep with their head arched and their mouth open. Those little questions I'll ask. And if they're a restless sleeper, tossing and turning, I look at that. Also during their exam, I look into their mouth because with obstructive sleep apnea in children, small kids, small airways. And so if you have like your tonsils and they're enlarged, or even your adenoids, which you can't see from someone's mouth, you have to literally use a tube to go down there. And usually the ear, nose, and throat doctors will take a look at, or you can use certain scans to see that as well. Then they might have obstructive sleep apnea. And then that's when I would do the sleep disorder. As I was mentioning earlier, if they are tired during the daytime, or if they are very restless or moody, what the parent says, but what the child says is really important.
So, you're saying for the children, do you get them to draw sometimes?
Yes, I'll have them draw or just see how, in what words will they put it? Because even though they might not say, yes, I feel this creepy crawly sensation that's going all the way up to my legs, especially in the evening, doctor. They might not say that.
Yeah.
Sometimes they say, my legs feel weird at night. I'm like, oh, let's talk about that. Well, they feel weird and feel like this itchy feeling. Oh, what happens when you move your legs? Like, oh, it feels a little bit better. So like trying to figure that out. And then sometimes, I will have them draw pictures. Show me how you feel. And, kids love to draw pictures. I might do that with my adult patients. I was like, you know what? Why don't you draw a picture of how you feel? Because right now you're not telling me.
Yeah, you should try it, definitely.
What are some common misconceptions about sleep disorders that you've encountered in your practice?
I don't know if I have time to talk about all of them. So I'll give you the most common ones. Well, one, I tell this to everybody. I even say this on social media. Snoring is not normal. And a lot of people, if they see someone snoring, they're thinking, oh, wow, they're really sleeping deep. Like, no. And I tell people this in my clinic. When you fall asleep, all the muscles in your body relax, the muscles in the back of your throat. So if that's your mouth and back of your throat, when you're awake, airways open, air's going in and out, but muscles relaxed right in the back, you get small. So when you're sleeping and breathing in, this is the sound people hear. That's how snoring is happening. And that's not normal. And sometimes with obstructive sleep apnea, it can relax some more, then all of a sudden airway is closed. So no oxygen is going to your heart and your brain. That is dangerous. So if you're snoring means you got to ask the question. Now, if you're snoring, does that mean you have a sleep disorder? Not necessarily, but it means that you should ask those questions. So that's one misconception too. And the thing is, you need 7 to 9 hours of sleep. A lot of people feel like, oh, I can get 5 hours of sleep and I'm fine. And I believe them. I believe that they think they're fine, but Mr. Snowman wants his money, and how you pay him is by sleeping. And even if you don't have a sleep disorder, that can still lead to disorders like obstructive sleep apnea. It can lead to like high blood pressure, diabetes, and stroke. And even with obstructive sleep apnea, it makes those worse. But if you don't have obstructive sleep apnea and not getting the recommended amount of sleep, it'll still lead to those disorders as well. And then another one, if you fall asleep and you're getting the recommended amount of sleep and you wake up and you're still tired, then a further investigation should go. You should talk to your sleep doctor. You should talk to your provider to get information. And if your primary provider is like, people are tired, no. If you're getting the recommended amount of sleep and you're still tired, that should open doors to answer other questions. And that's when you get a sleep professional involved, because we go through the gambit of asking those questions to make sure that you don't have another disorder. And at the end of the day, unfortunately, a lot of people will get diagnosed with like, oh, this might be depression. It might not be. It might be a sleep disorder. It might be a central disorder of hypersomnia. For example, narcolepsy, type 1 or type 2, or idiopathic hypersomnia. And that's a fancy way of saying that it's not narcolepsy, but somehow your body is still tired after a recommended amount of sleep. And so those are some of the big misconceptions about it. And one more, with obstructive sleep apnea, a lot of people might know a little bit about obstructive sleep apnea, but everyone knows about the CPAP and everyone knows about CPAP. And I always tell patients that come to my office, there's more than one way to treat obstructive sleep apnea. I have a CPAP myself. I love my CPAP, but it doesn't work for everybody. And depending on the severity, there's many ways to treat obstructive sleep apnea. Medication, the mandibular advancement device, myofascial therapy, and functional therapy can help you. I like starting with CPAP therapy first because it gives us a report to say if your sleep apnea is treated. And we know it works.
Before I got diagnosed with narcolepsy, they thought I had sleep apnea. So I tried the CPAP machine when I was sleeping. When the air would go in, it felt so forceful. I felt like I was suffocating. And a lot of times I would just rip it off at night.
Yeah, and I've heard that so many times. And that's why I'm always big on people telling people that there's more than one way to treat obstructive sleep apnea. That's one thing. And then the second thing is it really sleep apnea? If they got you a CPAP, they must have done a study to show that. That's when I tell people, and my patients, hold us accountable. If you're not sleeping well, I'm not doing my job. I like doing my job.
What about the high blood pressure, stroke, heart, those other things? You mentioned, it's only recently I discovered that there was a link between like sleep apnea and one of those ones that you mentioned. I think people don't really know or are correlating their sleep illnesses with these other illnesses. I think if the public knew that sleep affects every function in your body, they would take sleep more seriously if they knew there was a correlation. They're talking about diet and water and stuff like that. But when you think of heart and stroke and high blood pressure, those are things that people like, they really don't have that.
Well, that's why we're doing things right now. We're on a platform and we're talking about this. And so people that are listening, it's like, wow, we didn't know, but now they know. And I always tell people that knowledge is power. And here's the thing, when you are sleeping and you have a sleep disorder like obstructive sleep apnea, your body is literally going through chaos. What does that mean? Your oxygen is going up and down like a roller coaster. That increases stress signals. What do those stress signals do? Those stress signals affect your heart, your lung, your brain. It can increase your blood pressure because it doesn't know what's happening and it's going through chaos. It's in survival mode. It holds on to calories. And like you said, yeah, it's harder for people to lose weight when you are going through that as well. And then, like you said, those stress signals that can make high blood pressure worse. And even with the American Heart Association, and then even with cardiologists, they're saying if you have high blood pressure and it's uncontrolled, you have to look for other disorders like obstructive sleep apnea. And that's actually one of the treatments with your antihypertensive, treating your obstructive sleep apnea, even if you are using CPAP therapy. And so there's people that know about it, but we're doing it right now. We're talking about it to make sure that people are aware of this so it can get treated.
We talked about CPAP a lot, and I know that you said that many patients might struggle with CPAP. Is there any alternative treatments that you would recommend?
Most definitely. As I said, it depends on your severity. If you have mild to moderate obstructive sleep apnea, there's something that's called a mandibular advancement device, which is the device that you literally put in your mouth and it moves your jaw forward to open up airway. There is myofunctional therapy where they treat to strengthen your soft palate and strengthen those muscles to help with airway. And that's with mild to moderate. Now, moderate to severe, you don't have that many options. There is a mandibular advancement device that can treat severe obstructive sleep apnea. There's even medication, because if weight does play a role with it, there is weight loss medication. Recently, tirzepatide, which is known as Zepbound, where it can treat moderate to severe obstructive sleep apnea. And they've done studies with that just came out. The trials came out at the end of 2024, where they talked about it. And it's amazing because now there's literally a medication that comes out. And there's another medication in the pipeline that's going to treat obstructive sleep apnea as well. So there's many ways to treat it. There's also surgery that you can do. Usually that's like my last ditch effort. But then there's also a procedure that's called a hypoglossal nerve stimulator. A lot of people know it as Inspire, that what it does, it moves your tongue forward to open up your airway. And that's for moderate to severe obstructive sleep apnea. So there's many treatments for obstructive sleep apnea. A lot of people know about CPAP therapy, but there are other ways. And that's one thing that I love telling people about it, because sometimes I'll see a patient and I'm like, hello, my name is Dr. Allen. They're like, I'm not wearing that CPAP. They don't even say hi. That's the first thing they'll say to me. And I'm like, I understand that, but let's talk more. And that's why I always tell people that there's more than one way. And actually, it takes the pressure off of using CPAP therapy. You know, I tell them all this scary stuff about their body going through chaos and their oxygen dipping down. But then I tell them that, look, treating your obstructive sleep apnea, that there's many ways for it. And that's the thing that I love about it. And CPAP is still an option, because I've had patients that tried other ways and they're like, you know what, I can go back to CPAP and try to use it. And so, yeah, there's many ways.
That's good to know. I know the people that do use the CPAP or people that are newly diagnosed will be like, oh, okay, it's not all bad. I have options. Let's talk about sleep and heart health for a second. How is poor sleep linked to cardiovascular problems?
So, for example, for obstructive sleep apnea, your body's going through chaos. Those stress signals can increase your blood pressure and also put stress on your heart. So that happens as well. There's another disorder called central sleep apnea, where your brain forgets to tell your body to breathe. And that's a connection between your heart, your lung, and your brain. And that connection is off kilter, where somehow your brain forgets to tell your body to breathe. That plays a role as well. And so that can mess with your heart health as well, too. Then also, like I was saying, going back to cardiovascular disease, not getting that quality sleep and that chaos, that makes it worse. And also, even with narcolepsy, not having that treated can be concerned. There's been some studies to show that it can lead to cardiovascular disease as well, too. And so getting quality sleep is essential. Getting diagnosed with your sleep disorder is essential as well.
Yeah. Are there any early warning signs that people should watch out for that link sleep issues to heart risk?
It's funny because that's like the chicken and the egg and what comes first. You have cardiovascular disease. One of the pillars that you will want to look at is your pillar of sleep. Are you getting enough sleep? Are you snoring? When you wake up, do you feel rested? Talk to your bed partner, talk to your bed partner, and talk to your bed partner, because they're going to know more about your sleep than you ever will. And it's funny, it's real eye-opening for my patients, because we'll talk to them and they'll talk to their bed partner. He's like, wow, I didn't know I slept that bad. I was like, well, you never asked. Now you did. And they figure out what's happening. And so that's the biggest thing is if you do have a cardiovascular disease or any cardiovascular disorders, look at your sleep. And if you are waking up and you're not feeling like you are alert, look at your sleep, because it could lead to those cardiovascular diseases and disorders.
How can parents spot early signs of sleep disorders in children?
And we talked about that for a little bit, but to think about that, the same thing. If you see that they're sleeping and they're sleeping with their neck arched or their mouth open, or if they're very congested all the time, that can be a concern for a sleep disorder like obstructive sleep apnea. Also, if you notice any pausing and breathing, also take a look at that. Or if they're jerking in the middle of the night as well too. Or if they're a restless sleeper where they're tossing and turning. Because sometimes it might not be a breathing disorder. It might be like periodic limb movements of sleep, where you can move your legs in your sleep, which will turn into a disorder and they're not getting quality sleep. Or it can even be restless sleep syndrome, something new within the sleep medicine world, where their kids are just tossing, turning. And that's linked to iron levels, and where you get to check your iron. And not just your iron, the little bank that iron goes into, they call that ferritin. And if that's below a certain point, it can still be normal, but below a certain point, that can affect their sleep as well. So I would tell...
Yes. Repeat it. Say it again, because I keep telling people this.
I know. I will say it for the people in the back.
Yeah, if they don't see it, like my GP said to me, "Where did you read this?" And I said, "Oh my God, I am not making it up. This is facts."
You're right. It is facts.
So it's too low for it to go away. I got rid of it in my 20s, so I know that it's the one disorder that you don't have to live with. So can we not work on pumping the iron up so we don't have to live with this?
The funny thing is that becoming a sleep doctor, they drill that into us. We have to have board certification where they bring up iron, like what level of iron that you need. And I've been practicing long enough, they even change the requirements of looking at their ferritin. And so, for example, you have to check the iron if there's any problems with restless sleep, especially in children, especially if you have a disorder like restless leg syndrome. Like I have it on my order set. When I think as soon as someone tells restless leg syndrome, I'm listening while I'm ordering iron to look at that. Because the hard part is iron can still be normal, but it's the storage of iron. And there's been too many times where I've been able just to treat with iron. Don't even have to put them on a medication, because there's medications to treat restless leg syndrome or periodic limb movement disorder. But sometimes just fixing the iron will do the trick. And I'll tell patients, I'm not going to put you in a medication unless I have to.
That's good. I like that.
What are the long-term effects if pediatric sleep disorders go untreated?
With sleep disorders, especially if you're not getting quality sleep, what happens at night affects your daytime. Even in adults, for efficiency, productivity, that plays a role. With children, that can play a role as well. So that can decrease your development, decrease your IQ, decrease your performance in school. And that's why I'm really big on people getting quality sleep, especially children, because those are your formative years. And the thing is that, for example, for obstructive sleep apnea, you take it longer. I mean, if you're not being treated and you get older and older, then you start getting some of the adult symptoms where it might lead to high blood pressure. It might facilitate you going into obesity. And so I'm really big on people getting treated, because, the hard part about sleep disorders, you might not on the outside see what's happening until years down the road. And a lot of people don't know that. And it's a lot of preventative from having that happen. That's one thing. another thing that happens is that when you treat that, one, it won't lead into like those disorders, but then you give them a chance to fulfill whatever that they need to. And where we were saying earlier, when you don't get quality sleep, it affects everything. It can affect your mood. It can affect your health. And a lot of people that might have other comorbidities or the disorders, it might make it worse. If someone has a mood disorder or they're depressed, treating their sleep disorder can make them better because they're getting better sleep. Or they have pain and they're going through pain management. Treating obstructive sleep apnea can help facilitate pain management. If they're trying to lose weight, it can help facilitate weight loss. Will it do it by itself? Definitely not, because if that was the case, everyone would have a CPAP. But there's ways to know that sleep is important. And if anything, it's not just important, it's a right that our body has and need. It's a necessity, just like water.
In your bio, I mentioned that you work with, is it Women Heart, the organization?
So I've worked with them a couple of times. I've done a couple of lectures with them, with Women Heart. Currently, I am on the executive board for Project Sleep, where they're a good patient advocate organization. And so I definitely help a lot with them as well. And yeah, I have my hands in a lot of things. And I do a lot of podcasts such as this, and also on social media where I try to make sleep cool, to at least talk about it and make sure that people are aware and know about it.
Yes, yeah, but online presence is very cool. It's like, oh look, a doctor that can laugh and chill out.
It's funny. It's a job in itself, I'll tell you that much. But
Yeah.
I love doing it.
Sorry. Yeah.
I get that all the time. Don't worry.
So what role do podcasts and social media play in educating communities?
Being in medicine, and I did a lecture on this, is that, the more we move forward in time, the more you have advances in technology. And social media is one of them. And a lot of people will look towards social media to get their answers. And that's one of the big reasons why I went to social media. I'm like, if you're going to go to someone, you need to go to someone that knows what they're talking about. And I've seen that. And so that's another way for us to reach patients. And I feel like there is an importance to it. You have to take it with a grain of salt, because when you have like a 30-second Instagram reel, you can only say so much or write so much down, but it starts that conversation. And, and it's a nuanced way to inform people. And that's one of the things I love doing. I love talking to people to put it in a way where they understand what's happening. I feel like I have a good skill with that so they can understand. Never want to talk over someone's head, and, I'll meet them where they're at. It can be like a CEO of a hospital group. And if I'm talking to them, I'm starting at the bottom line saying, look, this is a sleep disorder, even though I know you know about it, but we're going to go over this just to make sure, because I never want to assume someone knows something. So it's good putting it out there. And the hard part about it, it's second nature to me, but it might not be to someone else. So I might be putting, it's like, what? Why am I talking about you need 7 to 9 hours of sleep? I know that, but someone else might not know that. Or, what? Of course, snoring is not normal, but a lot of people, and I've seen videos like, wow, look at my man, and he's snoring. And it's like, look, I'm all asleep. And then, I'll go on and I'll put in the caption, my card, just to say, snoring's not normal.
It's true. We have grown up hearing that it wasn't a big deal. It's like, yeah, some people snored, some people didn't snore. And especially if you weren't overweight, they would just say, oh, this is how the person is. There's nothing wrong with them. But if they were overweight, then someone would probably say, oh, it's probably because they're overweight. If they lost weight, they would stop snoring.
I know, and that's the hard part, because sleep apnea, it just doesn't look one way. It can look different in men and in women. Obesity does play a role, but those are risk factors. And we look at every aspect to see if they have that, especially in women that are either perimenopausal or around during menopause as well, to look that there's concerns for like sleep apnea.
Yeah, I know. I snore at night. My mom tells me all the time. And I know it's because I have a narrow airway. And I've had to because I had the trach, I've had to go to the ear, nose, and throat doctor, get the long tube with the camera. That is like always the worst part.
Well, very uncomfortable.
Yeah. But because I had the trach, I've had to go in and they've had to remove some scar tissue sometimes to help me like breathe or whatever. And it's funny because as many times as I've had it done, you would think that I would be not snoring as much or breathing better when I go to sleep. But I don't know. I just kind of like equated the having the trach and stuff to like, this is how I sleep now.
Well, and that's the thing about snoring. You have something with breathing and there is restriction in your airway, but more so snoring is more of a soft tissue issue. And when you fall asleep, that's like well above the trachea. And if you're still snoring, and I know at one time you said, hey, they wanted me to use CPAP therapy and you had problems with it, you should readdress it. And because there's, as we said, and it's a good circle back, that there's more than one way to treat sleep apnea. And so if there's snoring going on, you can say, well, CPAP didn't work for me, but hey, listen to this tape of my podcast. And I had this sleep doctor, because he isn't wearing a white coat, and it says he's a sleep doctor, says that there's different ways to treat obstructive sleep apnea if there is a problem. Throw that out there for you and anybody that's listening.
You hear that, listeners? Go ahead, Sakar.
Yeah. So what is one myth about sleep that you wish you could permanently debunk?
Whew, that's a tiebreaker. So if one of these two can happen, then I would be okay with it. That one, snoring is normal. And we talked about that before. If people's like, whoa, he's snoring, let's get that looked out to debunk that myth. That's one of it. And then the other one is there's more than one way to treat obstructive sleep apnea. People think that CPAP is the only option. So if I could debunk one of those two, I'd be a very happy man. And then a close third, I just had to throw it out there. So the first two ones, really happy. Third one, I would be happy too. People thinking that you need less than the recommended amount of sleep. That is such a myth. And there are short sleepers out there, but that percentage is so small, like more than likely you're not. And you can't base it on how you feel. So that would be it.
Yeah, those three are really interesting ones. And it's really great that we are talking about this because I know as a person with narcolepsy, I do struggle with getting my 8 hours. I'm getting better, but I know the average American does not get 8 hours of sleep because we live in a society where it's just like, how much can I accomplish in 24 hours? Or if you're tired, run to Dunkin' Donuts and get a coffee.
Hustle culture is real, and it's hurting people. It's hurting our people. It's hurting patients. I've seen videos it's like, if you sleep and you ain't grinding. And I'm like, no, there's studies to show that if you get the recommended amount of sleep, you're more efficient. And I'm a man of efficiency. And so you need to get the recommended amount of sleep to be at your best to do that. And unfortunately, a lot of people will sacrifice sleep first in everything. And unfortunately, that was me when I was younger. That's my colleagues when we were in med school together, or anyone in college is like, oh no, like I got a test that I need to study more for. What do? They stay up or pull up all-nighter. And then that's making it harder for them on that because like the brain, like memory consolidation, that's not happening. And so, yeah, hustle culture is real. And what I do my best to debunk that.
That's good.
I think that's all the questions I have. Curly, you have any other questions?
Yes. So, Chris, do you have a family? Are you married?
So yes, yes to both of that. I've been married for 15 years to my wife. She is an obesity medicine doctor. So it's a good combination. She has her own practice, I have my own practice as well. We have two lovely kids that are soon to be 9 and 11. So yeah, they keep us busy. And those are my pride and joys as well. on most days.
That's really beautiful. I think I saw on your Instagram page, one of your links was the blackbusiness.com. You and your wife opened your first Black practice.
So we're one of the first, Black couples in our city to have like a joint practice. And when I say that, she has her practice, I have my practice, we stay in the same building. And because to be fair, she's been doing her practice longer than mine. And if anything, she's been an inspiration for me to say, you know what, she can do this. You know what, I could do this too.
Oh, that's so nice.
Yeah. We share a room in a house, and we share an office.
Oh, that's so nice. You know that your marriage is going well. If you see your spouse at work and then also at home, it's like you're never without them.
The cool part about it is that when we're both here, we're both busy. So we can barely see each other. We see each other for lunch, and then she only works part-time here. So that helps, because I agree. If it was all the time, it'd be nice if we were doing things that were relaxing, but no, we're working. So when we're here, it's business, and then we take a little break from business, and then, it's a nice thing to have. And I don't take that for granted. We are both very busy, but hey, if I can give it a quick little look, a quick little hi, I definitely do appreciate that.
Yeah, it helps. Both my parents were teachers, and they taught at the same school, both back in Jamaica and even here in London.
That is just so beautiful. It's so important for people that look like us, African Americans, to see Black doctors doing what they do, because we don't. As a race of people, we've had this stigma with doctors, going to the doctor. So it is very important for us to see powerful Black doctors changing the game.
In the United States of America, there's historical facts where there's a mistrust and a distrust, and there's reasons why. And so when I open the door, because they see me, Sleep Dr. Chris or Dr. Chris Allen, it's like, oh, and they open the door, it's like, whoa, hey, how's it going? When they see someone that looks like them, I don't take that lightly. And I know that does play a role too. I love helping everybody, but if I get to help my own as well, that's a special place in my heart too.
So, Dr. Chris, in the neurological field, what's the percentage of Black doctors in the States?
Low.
Is it?
I want to say it's like maybe 10%, and it might be even lower. And knowing that when I did my training, sometimes I'm like one of the very few Black doctors there, and not even talking about Black males, which is even lower.
Oh my God.
Single digits, like 2%, and especially in neurology. And most of the time I was like the only one. And so I'm aware of that. I know that. And that's why it's special to me. I know the cross I bear, even if I didn't want it, it's there. But I feel like, not that I'm a good Black doctor, I'm a good doctor. And I'm going to make sure that take care of anyone that's my patient. I'm going to take care of them and make sure that they're doing well. And you can ask them.
That's so cool. Thank you so much for coming on Narcolepsy Navigators. I might have to talk to your wife about coming on, because, she specializes in obesity, you said. And it might be interesting to see her take on the role of that in sleep.
Oh, well, yes. And it's funny, we've done podcasts before together in the past. And I think, I don't want to talk for her, but I think it would be, if you want to reach out, like, definitely.
Yeah, I'll reach out. You plant a seed and I'll reach out.
I'll play the husband role and just saying, hey, this is information. And I've already put this stuff out there. If it happens, if it helps, that's great. That's up to her. But no, I'm very happy that I've been able to talk to you guys. And like I said, I love talking about sleep. And anyone that's listening, Sleep Dr. Chris, you put Sleep Dr. Chris, like and follow. And if you have any problems with sleep, I got 4 words for you. You know a guy.
I like that. That's such a nice way to end.
It was lovely meeting you. We have tried to schedule this interview so many times. When I saw your social media, I'm like, I have to meet this doctor. Like, who is this guy?
That's been the ultimate question. Like, who is Sleep Dr. Chris? Because I've only been doing this for a little over 2 years on social media. So people get a lot of that, but slowly but surely, I'm putting my name out there. People are knowing it. And I'm just a guy that likes to talk about sleep and making sure I can do what I can to make sure people are getting quality sleep.
I like to end saying happy napping, everyone. So
happy napping, everyone.
Happy napping, everyone.
I just want to say too, happy napping, everyone.
Oh, this was lovely. Thank you so much, Dr. Chris.
You're welcome.
Narcolepsy Navigators is produced by a team of volunteers working for the Naps for Life CIC, which is a non-profit group dedicated to improving the lives of people with sleep disorders through community action. You can help grow our podcast and join our sleep disorder support group by visiting the website www.napsforlife.com. If you or someone you know has a sleep disorder and would like to share your story on Narcolepsy Navigators, please email us at narcolepsynavigators@gmail.com. You can also support us by donating at the website. Happy napping, everyone.